it is a difficult diagnosis to make asthma, and the reason it is difficult is because it's a variable disease. It could be normal on a good day, patient could be completely normal and not good on another day. So it's a very variable illness or a disease which is chronic. So one has to understand this. And then there are grades of severity that could be very mild, could be moderate, or could be very severe, spectrum of disease and symptoms. But investigations wise, when they come to see us in the clinic, we would want to make sure a simple chest x-ray is done. And the chest x-ray is vitally important to get done, because these symptoms of cough could well mean something serious as well. So by doing a chest x-ray, we will exclude any serious cause for the symptoms of a patient. So if patients have, especially cough, if you have cough for more than 6 weeks, that's not a good sign. You need to seek attention from a doctor. And I think chest x-ray is very, very useful and important. Once we've done the chest x-ray, it's normal, we can reassure our patients that there is nothing serious on their chest on the x-ray. But the other test we do is blood tests. So we do full blood count, or CBC, which means we check for eosinophil count to be raised. We also do immunoglobulins E, IgE we call it. And then we could do RAS testing, which means we could do serum allergy testing as well, from the blood, to find out what you could be allergic to, because it's very important to avoid those allergens if you know what somebody is allergic to. So to avoid the allergens is a part of the management of asthma. So it is vitally important, friends, to have this allergy test done, so we know what things could be contributing to the asthma. And apart from that, we can also do an exhaled nitric oxide measurements. We call it FeNO in short term. And it's available in our clinics, and it's a very good test. And if you're scoring 40 or above 40 parts per billion in the exhaled nitric oxide, that suggests that you have airways inflammation or you have airways allergy, asthma. So FeNO or exhaled nitric oxide is another jigsaw piece to put in the puzzle, because we need to see the full picture of asthma, and it's a very difficult diagnosis to make. So it is vitally important that these tests that I've just talked about are done. And if there's any worries of an infection, that we can check for CRP as well on top of that. So these are very basic tests we do, and then we would go into managing these cases once the investigations are done. Because a lot of my colleague doctors who are in primary care ask me this question, that what about spirometry? So yes, we do spirometry, and we can do bronchodilator challenge test, and we see how the reversibility FEV1 changes, or the spirometry shows an obstructive picture and how much change happens. So the change we're looking at is usually 15 to 20% after bronchodilators, or reversibility assessment, 20% change. And same with the peak flow meter monitoring that I showed you, the peak flow monitor. So when we are using that, we are looking for about 15 to 20% change in the variability. Now, sometimes all of these jigsaw pieces that I've talked about does not get you the full picture, and you're still not sure of the diagnosis. Then there are other investigations one has to think about on a particular individual's case, like doing a CT scan to rule out bronchiectasis, or to do a challenge test we call methacholine challenge test. And this methacholine challenge test is an additional test which can give us a diagnosis where other tests or other pieces of the jigsaw puzzle have failed to give us a full diagnosis. So going back, recapping, that we should have a good history and know about the patient and the allergies they have, examine the patient, arrange these investigative things, and then get them on the right treatment. Now, treatment is always a trial, and it's very important the trial of treatment is given to the patients on the initial consultation, so their symptoms can be controlled. And when they come back with a peak flow meter chart, you can see what the inhalers is making a difference.